What is flexion? Digging deeper down.
Let's talk about some misnomers, right? What have I learned in my years as a clinician? I used to believe the doctors knew what they were talking about. I used to believe the referrals when they came in. Rotator cuff tear, assess and treat. Okay, thanks. That's a post-it note, not a diagnosis from my perspective. I'm going to do my own assessment of the patient and determine what's truly going on. Now, being a PT, which means doctors up here and PTs down here, I need to know my place in the hierarchy. My place in the hierarchy is not to go back to the doctor and say, you got that one wrong. It wasn't a rotator cuff. They complained of pain coming from their neck, going out to their shoulder. And when I moved their shoulder, they had no pain. But when they moved their neck, they got their pain going out to the shoulder. They were a cervical or cervical patient. You don't say that to the doc, obviously. You're going to cut your own throat and lose another referral source, right? On that point, you have to be kind of diplomatic with patients too. Yeah, I looked at my prescription, it said rotator cuff. I went to the Mayo Clinic, I did Wikipedia, I learned all about rotator cuff. And now you're treating my neck. Why are you treating my neck? These kind of conditions often have multiple presentations. In this instance, a lot of it's coming from your neck. There are some things going on in your rotator cuff. That's why we examined it and moved it. But in reality, in this instance, we've got it straightened out. That's the key thing, right? What do you call the person who graduates dead last from chiropractic school, osteopathy school, medical school, or physical therapy school? Doctor. Someone asked me recently what drives me nuts. And what drives me nuts is clinicians who don't assess their patients and they follow recipes and protocols. Whether it's something that's developed by a company, whether it's something that's the way we've always done it in the clinic, that's crazy.